All right, we're gonna go ahead and auscultate heart and lungs of a dog here. I've got Nash here with us today. So what I wanna do is I wanna start by putting on my stethoscope. Right, Bubba? And we're going to use our bell to go ahead and start listening. You want to listen right behind the elbow, and you want to make sure you listen on both sides. You want to listen for any murmur, so any whooshing in between heartbeats. You want your heartbeat to be strong, clear, equal beats that are a definite rhythm. All right, I also want to go ahead and take his heart rate. You can do that by wearing a watch, or I've got a timer here. I'm going to count out some time, so I'll start my timer. All right. After I listen to his heart, I want to go ahead and give his lungs a listen. I want to make sure I'm listening in all quadrants. I'm listening for any wheezes or crackles. Once again, you want to make sure you listen on both sides. You also want to make sure that you listen to the trachea. Big yawn. All right, now I want to also take his respiration rate. So I'm going to look back over here at my handy dandy clock I've got over here. All right. Our heart rate was about 90 and our respiration rate was about 30. The way that we calculate that is by counting the breaths per minute or heartbeats per minute within a defined time, so 10 seconds or 15 seconds, and then multiplying them. So if you were counting for 10 seconds, you would multiply that number by 6, or if you're counting by 15 seconds, you would multiply that number by 4 to then calculate your heart rate or respiration rate. Ready to do an EKG on this dog, Diesel. He was brought in today for an EKG check. We've got him in right lateral recumbency, and I'm about to hook him up to our EKG machine. So we've got our 3 leads here. A little rhyme you can use to remember is white on the right and then smoke over fire. So we're gonna hook him up here. We're gonna pinch just a little bit. And then your smoke is your black lead. That's gonna go right here on the skin of that elbow. And then the right is down here. Hey, Bubba.
It's okay.
All right. And then we're gonna just put a little bit of alcohol on the leads to make sure that they read. And let me just grab the alarm on our machine. What we see here is really good normal sinus rhythm. It's a little bit elevated, but that's pretty normal for dogs sometimes in clinical settings. The end. All right, today I'm going to demonstrate how to use a rabies pole. What we've got here, we've got our string, we've got our loop that will go around our doggy's head or cat. The way that it works is you just put the loop around the animal's head, and then you pull on the back to tighten the noose. It allows you to stay a good distance away from animals that we may not know, maybe aggressive, things like that. After you have successfully restrained them and you need to release them, you just pull the releasing mechanism. It opens up the loop again, and so that they can get out of it. we're going to use this on our doggy here, Zed. We're going to do it very quickly because sometimes it can stress out animals. It's an odd sensation. So we try and only use it when it's necessary. So Zed is getting a nice steady amount of treats. You slip it over the head, tighten it,
Okay, good boy.
and then once you're done restraining, what I'm going to do, if you want to, is pull the release mechanism so that the loop opens, and then we just slip it back over his head. Alright, we're going to go ahead and do a free catch urine on Nash. I've got my tray here, so we're just going to go ahead and walk him outside. Find a good spot. You want to make sure you keep a short leash so you're near enough to properly place your tray whenever they find a spot. What's in the middle, not what's in the front or in behind. Alright, we're going to go ahead and I'm going to show you how to appropriately clean a kennel. So this kennel a kitty cat was in. The first step we want to do is get all the large debris up. So there's a little bit of litter here. So I'm going to put it all together in a pile. You want to make sure that you're wearing a good pair of gloves when you do this to protect yourself from any kind of yuckiness that may be lingering in the cage from the animal that was in it. I'm going to go ahead and scoop it into this dustpan that I've got. And we'll go ahead and throw this in the handy dandy trash can. Alright, I'm going to just set this down so it can be properly cleaned. The next thing we want to do is spray it down with a disinfectant. Now this disinfectant has a contact time of 10 minutes, so what I'll do is I'll go ahead and spray down the kennel. I want to make sure I'm spraying all the surfaces, not just the floor, the walls, the ceiling, everything. Alright, and that has a contact time. We also want to make sure we get the door. Of 10 minutes. So what we'll do is we'll let it sit for 10 minutes and we'll come back and wipe it out. Alright, so our kennel has been sitting for 10 minutes, actually 11. We're going to go ahead and wipe it out. I won't make you sit through wiping all sides, but you want to make sure that you are wiping in a continuous pattern so that you make sure that you're getting all of those germs up. If you find that it's dry, you can spray it again with more disinfectant just to make sure that, you know, if you have something that's stubborn, you can get it up. Sometimes a little bit of extra cleaner will help get the stickies up. Yep. Okay, all right, we're going to go ahead and prep Diesel here to have a urinary catheter inserted. So first I'm going to extrude the penis. Come on, Bubba. There we go. Alright, and then we're going to go ahead and prep that area. get our supplies, I'll change into sterile gloves. Alright, so I've got my gloves. Now I'm going to go back up and get my catheter. I'm going to estimate the length that we're going to have to insert it. And then I'm going to go ahead and lube it up with the sterile lube that we put on our tray earlier. Go ahead and insert it. And advance it gently. You shouldn't feel any resistance. I'm going to go ahead and grab my syringe. There we go. All right. So I want to go ahead and I want to waste that first amount of urine that we get. And then I'm going to grab my fresh syringe. And then we'll go ahead and get our urine sample. He did just urinate outside, so there is only a small amount. But we've got our sterile sample. Alright, we're going to go ahead and do a cytocentesis on Hope. I've got a small amount of transducing jelly on my ultrasound probe. I'm going to locate the bladder via ultrasound. We're going to go ahead and prep the area with an alcohol wipe. Going to uncap my needle. And we are retrieving our urine sample. I'll go ahead and release on my negative pressure and withdraw the needle. As you can see, we have retrieved urine. Okay. Alright, we're going to go ahead and do a Schremer tear test on Zed here. It's a test to measure tear production. First thing we want to do is get our clock ready. We've got our strips over here. They are labeled, one for the right, one for the left, so whenever you're doing this, you want to make sure that you have the correct strip, just so you record your results appropriately. You also want to refrain from touching the part that actually goes on their eye, just to make sure we don't get any debris in there. So I've got this strip. I'm confirming it's for the right eye. And we're going to go ahead and open the eyelid up a little bit. Okay, and place it right there. Now the eye can be held shut or they can be allowed to blink freely. We want to start our timer for 60 seconds. Now if it falls out, you can restart. We'll go ahead and move on to the left eye since we have this package open. Okay. We want to make sure it's really in there. And we're going to just hold it closed and restart our time for 60 seconds. These strips have dye in them, so you can see exactly how far down the strip the moisture is going. And then your tear test will come with a nice little paper here that explains how to interpret the results appropriately. Hey, Baba. Sometimes they can be a little bit weirded out by it just because it's kind of a different experience. It's not something that happens frequently. So they can be a little bit anxious. That's entirely normal. Just keep them calm. Treats are good. Peanut butter is always a good thing. We're just waiting on this timer here. We've got about 6 more seconds. All right. We're going to go ahead and remove the tear test. And you can see on the strip that it's come all the way down between our 20 and our 25 millimeter line here. So we can just take a peek at our chart here, and it lets us know that we are within normal range for dogs. So we would consider him to have normal rate of tear production. Yeah. Over.
Go ahead.
All right, we're gonna go ahead and use a tonometer pen to check the pressure of Weasel's eyes here. So we went ahead and numbed them about 90 seconds ago with proparacaine eye drops. All we've got to do is press down on our little button here. I'm going to gently open the eye, and then we're going to
Stop holding the button. Hey. There you go.
okay. All right, and then we have our little number reading down here. We're good to go. And his eye pressure is 21. All right, we're gonna go ahead and do a fluorescein stain on Lana's eye here. I've got my strip. I'm gonna go ahead and tear the packet to open it. I'll remove it from the sleeve. Now for optimal results, what you want to do is go ahead and use your saline solution or eye wash to moisten the end of your test strip. So we'll put a couple drops on there. And then we'll go ahead and go to Lana. Open up the eye and put it right here in the corner in the conjunctiva. Hey, baby. All right, there we go. We want to let it take up that stain. I know it feels funny. It tastes funny too. Sometimes you'll see them lick their lips. We're gonna tilt her head back just a tad and I'm gonna put some saline in there. Okay. And I'm going to wipe out the excess so she doesn't have stain running all over her face. Poor little lady. Got an eye boogie, Lana. All right, so I'm gonna take a pen light now, or in this case, I'm using the light on our otoscope because my pen light battery is dead, to go ahead and shine it into that eye and examine it for any scratches or scrapes. If there are any type of abnormality on the eye, you will see a concentration of dye there, basically outlining the defect. We see nothing on Lana's, so what we'll do is we'll go ahead and flush it one more time with some saline, and she will be good to go. All right, we're gonna go ahead and perform an anal-gland expression here on Sophie. So I'm gloved up, I've got my supplies, I've got some gauze nearby, and I've got some odor eliminator as well. So I'm gonna go ahead and apply some lube to my index finger. we're going to lift the tail. Ideally, you would like your patients to be standing for this, but sometimes they're not compliant. So we're gonna go in. Hey mama, good girl.
There she is.
We're gonna feel down here for our anal gland. And that side is empty. And then we're gonna go over here. Check their other side. Sometimes they can vary on where they're at from dog to dog. But they should be there on both dogs. Okay, all right. We've got a small amount here. Hey, mama. I'm going to express it right into my 4x4. Place it off to the side to be thrown away. Remove my gloves. And then we're gonna just spray her down so she smells nice when we take her back to mom and dad. All right, I'm gonna walk you through the steps of administering a basic warm water enema. We've got Nash here. He doesn't necessarily need an enema, but he is here as our participant. What you wanna have, the supplies you wanna gather first is of course a tray of lukewarm water or a cup of it, depending on the volume in which you have to administer. Obviously, the larger the animal, the larger the volume is generally the rule of thumb. A veterinarian will help determine the appropriate amount, although sometimes it is trial and error, as each animal works a little bit differently. So you want to have a syringe for administering fluid. You want to have that warm water. Like I said, we want it to be lukewarm, but not hot. We've got mineral oil. Mineral oil acts as a lubricant both internally and externally. It helps the tube advance, and it also helps kind of things stay lubricated internally. So I'm going to go ahead and add a few drops of mineral oil to my warm water here. And then I'm going to draw it up with my syringe. Then what we can do, a lot of times you can put this in the warm water. It helps the tube become a little more pliable. It'll help it get coated with that mineral oil so that it advances more easily. If you need to, you could always use some lube. A small amount will help it advance more smoothly and be more comfortable for the patient. We would then, if we were going to administer this, go ahead and we would have a tail holder. We would start by inserting our finger into the rectum, and then we would slowly advance the red rubber catheter past it, at which point we would then attach our syringe to it, make sure that we're getting it in there far enough to actually do what we want our enema to do. Another method would be to have basically a funnel. It's what you see more in large animal, is to have a funnel at the end of your tube and you let gravity do the work of putting that warm water and mineral oil solution in. After you administer an enema, cat or dog, you want them to be in an area where they can defecate freely. So if it's a cat, you want them to have a fresh litter box. If it's a dog, you would prefer them to be in an outdoor run so that they can defecate freely and not be in gross conditions. Okay. All right, we're gonna go ahead and administer topical medication on to Atlas here. He's got some sensitive skin. He's got a slight papular rash. We're gonna go ahead and put some chlorhexidine solution mousse onto the affected area. We cleaned him first. We gave him a bath, and now we're gonna go ahead and apply it now that he's nice and dry. So we're just going to squirt a couple pumps into our hand and then apply it in the affected area. We want to make sure that it's worked in well. All types of topical medication will have their specific instructions. Hey, Baba. And we're just going to keep him distracted until it dries. so that he doesn't look at it. You always want to wear gloves when administering topical medication so that you don't have any skin irritation yourself from whatever types of medications that you may be using. All right, we're going to go ahead and clean and medicate our doggy here ears. This is Nash. Before I do anything, I like to make sure I have all of my supplies. So what I've got gathered here are some cotton balls, some 4x4 gauze, micellar cleaning solution, and an ear pack. I went ahead and pulled that into a syringe for easier administration, and I've got that sitting here out of the way so that it stays nice and clean. Whenever you're cleaning their ears, you want to make sure that you're being gentle. You don't want to go in there with anything that could break off, like a long Q-tip, something like that. So what I like to do is go ahead and moisten a few cotton balls with the cleaner. Just put a couple drops on each. We don't want to oversaturate our ears. And then I'm just going to go ahead and come in here. Hey, Bubba. I'm going to pull the ear back like this, and then I'm going to get as far down in the canal as I possibly can. Oh, does that feel good, buddy? All right, I want to sweep it outwards so that I get all of the dirt and debris out. Go back to my next pre-moistened one. Bubba. We want to get all angles, so make sure we're getting in there good. You want to repeat this process until the ears are completely clean. Hey, Bubba. All right. I'm going to actually moisten a couple more. Alright, so now that those are coming out good and clean, I'm going to go ahead and make sure that my ear is dry. I'll use a 4x4 for this. Once again, we want to get as far down in that canal as possible. Oh, does that feel good, Mama? If you were sedated or something like that, then we could use something to get a little further down in the canal. But while they're fully awake, we don't like to do anything in case they shake their head so that it doesn't get damaged. Hey, so I want to just open this up, insert this as far down in the ear canal as possible, and then just squeeze. I know, does that feel funny, bud? I'm going to give it a rub so that we make sure that it distributes through the ear canal. And then we're all good to go. We'll repeat the process on the other side and he'll be all set. Alright, we're going to go ahead and do an ear cleaning and instill some medication in a feline patient's ears. I've got Hope here. She has a history of skin and ear problems. We're currently treating her for both. We're going to go ahead and start. You want to be very gentle when you're cleaning kitty cat's ears. They're already sensitive creatures, and so we try and be as gentle as we can. I've got a micellar solution here. I'm going to just go ahead and wet a cotton ball. Instead of placing the solution down in the ear, it can often waterlog the ears. We don't want to put so much in there that it causes an additional problem. We want to visualize our ear canal and go ahead and get in there and wipe outwards. And see, we're getting some pretty good gunk out of there, so we want to go back. And continue to wipe. You may need to wet your cotton balls a little bit more. You want to be careful to use something that's going to be gentle on their ears, so you wouldn't want to use like a paper towel. You see now we're wiping and we're getting clean cotton balls out, so I want to do just one more wipe to make sure that that ear is clean and dry. We want to make sure that they stay dry. All right, everything looks good. So we're gonna go ahead, we've got an ear pack here, all ready to go, preloaded into our syringe. I wanna go ahead and visualize that ear canal. Place it in and instill that ear medication. It can sometimes feel a little funny, but then you wanna rub the ear to make sure it gets as far down into the ear canal as possible. All right. And now we would just repeat the process on the other side. Sophie here, our patient, some sub-Q fluids. I've started by attaching a fluid line, connecting it to our IV bag. I have a large gauge needle here on here. We're going with 18 today. She is a large dog. We're going to go ahead and come around here. We're gonna go right above the scapulas here, but we don't want to go up onto the neck. So what we want to do, we're going to go ahead and uncap my needle. I'm going to tent the skin and insert the needle, allow the skin to fall back. I'll keep my hand there, and then I'm going to go ahead and open up the line and let it flow freely. You want to make sure that your patient stays as still as possible. It can feel a little bit funny. These are warmed fluids, so it's a little more comfortable. It feels a little less awkward to them. We let it run until they have received the appropriate amount of fluids that's prescribed by the veterinarian, or until they're not able to sustain having any more fluids. At that time, we go ahead and remove the needle. You want to hold off on the area where the needle was inserted so that you don't have any leakage. Recap your needle and close off your fluid line first. We are all ready to stop fluids here, so we're gonna go ahead and close off our line. Hey Mama. We're going to remove the needle and then hold off there for a few seconds so that the fluid doesn't all escape. We're going to recap our needle, and then we will be all done with our sub-Q fluids. Alright, we're going to go ahead and do a nail trim on a doggy. I have a little patient here who is in the process of recovering, and so we're going to go ahead and work on getting his nails trimmed. Alright, so what you want to do, he's a little bit fluffy, so you want to make sure you pull the hair back. As you can see in the nail, you see the pink where the quick is at. You want to make sure that we avoid that area. So while pulling the hair back, you want to have your nail trimmers handy. Go ahead and you could take those points off. Take a small amount at a time, working your way back towards the quick so that you can get them as short as possible without causing any trauma to the nail. On darker nails, it can sometimes be harder to see where the quicks are at, but thankfully this guy has bicolored nails, so we're good to go. And that is how you trim nails on a dog. Alright, we're gonna go ahead and do a nail trim on a kitty cat here. This is Cocoa Bean. She is sedated. She doesn't like coming to the vet at all. So, what you're gonna do, you can see hers are pretty long. Sometimes you have to press down on the paw pad to make the nail become visible. You could see the quick, the pink area back on the back of the nail. We're just gonna take our nail trimmers and cut the tips off. You wanna start obviously near the end and go back in small increments so as to avoid quicking her nails. In the event that you do quick a nail, you wanna have something like Quick Stop or charcoal sticks, anything to help stop the bleeding and help the blood coagulate there. Alright, we're going to go ahead and apply an abdominal bandage on Lana here. She doesn't actually need one, but we're doing it for our demonstration purposes today. So if she did have a laceration, or in this case, for example, for instance, if she had had abdominal surgery and it had dehisced, something like that, we'd want to start with a non-adherent layer like a Telfa pad. And then we want to have our first layer, which is our soft cast padding. So, hey Mama, We'll keep giving you some more peanut butter while we go, if possible. So we'll stick our non-adherent layer down there, and I will begin to wrap. You want it to be semi-snug. Sometimes it will take 2 or 3 people, just depending on the patient, whether they're sedated and how compliant they are. It's kind of a strange thing. You want to get it as snug as possible without causing too much tension here. We're not going as snug as we normally would on an abdominal pressure bandage right now. Just for Lana's comfort, Amber, if I can get you to scoot your hand over here back just a tad. There we go, so it's not affecting the function here. When you're bandaging, you want to go about 50% of the width once you've got it started of your bandage. Hey mama, hey, you doing some peanut butter? Would you like some peanut butter, Lana? She says no. She's very stubborn right now. Alright. We can have her come out a little bit. And if I can get you to move your hand, thank you. What you want to avoid is any wrinkles. And let me grab my bandage scissors. I'll go ahead and end my first layer here. And we'll give Lana a chance to relax for a little bit. So you can go ahead and stop videoing right now. All right, now that Lana's had a chance to calm down, get some peanut butter and some cheese, we're gonna go ahead and start back on the next section of our bandage. This is the section you wanna definitely apply some tension. So I'm gonna just start here and wrap it all the way around. As you wrap it, you want to be pulling more, applying greater tension. And as you wrap down, same principle, you go about 50% of the bandage width all the way around. Excuse me. All right, and we'll go ahead and we'll pick up our video on the next step. All right, now that we've gone around with our cling about 3 layers, we're gonna go ahead and apply our top layer, which is our vet wrap. Hey. And once again, this is a layer that we do pull a little snugly on as we go around, just to make sure that it has appropriate tension so that the bandage doesn't shift out of place. A lot of times what I'll do is I'll unwrap my vet wrap first and then start it, just so you're not pulling too hard on your patient while you're trying to unwrap it. It seems to help a good bit. And the vet wrap is the same principle as your other layers. When you're going around, you want to do about 50% of the width. I'll go a little bit less than 50%, just because I want to make sure that everything is clinging to each other appropriately. And once again, no folds or wrinkles. Have a beautiful lime green belly, Lana. Makes it look like you're in a corset. I know that was a funny noise. Alright, I'll go ahead and wrap it all the way around, other side. The final thing we'll do is go ahead and put a small amount of elasticon on the bandage, on the front and back, so that it prevents slipping. For your elasticon, you definitely want to go ahead and stretch it out first. for the purpose of our demonstration, I will elastic on the front of the bandage and not the back, just because it is not medically necessary and I don't want to cause additional trauma to Lana and the amount of hair that sometimes is pulled out when you remove elastic on. Hey, mama. Alright. Okay, alright, so we'll go ahead and that is our abdominal bandage. We'll cut it off as soon as we end the video, just so she can be a little more comfortable again. Like I said, you get elastic on the front and the back. I know, it's hard being you. To help give it a little additional stability. Alright, we're going to go ahead and apply a modified Robert Jones bandage with a splint onto Nash here. I've got a stirrup started. It's just some white tape attached to a tongue depressor. I'm going to stick it on to the limb here with the tongue depressor hanging off the end of his toes. I know, it feels funny, Bubba.
It's okay.
Hey.
It's okay.
I can feel like a kind of odd sensation to them. So maybe just a little reassurance is needed. I'll go ahead and I'll tear the next one. This one will go on the underside of the limb. Now, ideally you like your stirrups to go up the full length of the bandage, so that it fully secures everything. Since this is just for demonstrative purposes, we're just going to go ahead and do a little bit. We're not going to bandage all the way up the limb. The next step is to apply cast padding. You want to start down here, leaving some toes out. And when we wrap it, we're just loosely wrapping it, and as we move up, we're overlapping that bandage by 50%. In a full Robert Jones bandage, you wrap the leg with cast padding pretty heavily, sometimes 5 or 6 times. Since this is a modified Robert Jones bandage, we're only going to wrap it about twice. And like I said, we can leave this one pretty loose. You want to make sure that there are no folds or anything like that, and then we start working our way down, once again going down the limb about 50% of the width of that cast padding as we go.
It's okay. It's okay. Kisses. Yeah. Give me kisses. Okay.
All right. All right, now we'll go ahead and move on to our cling. Hey, Bubba, we'll give you a break for a second.
It's okay.
I know, life is hard. So we'll move on to our cling, once again starting down at the toes. This is where you can put a little bit more pressure onto the bandage, wrap it a little more tightly. We want this to hold all of our good stuff in place. Hey.
Okay.
All right, we're gonna just give him a break for a second. Hey. I know, you hate it. I know. It's okay. It's okay, Bubba. All right. We'll go ahead and keep working our way up. Sometimes you just need to take a couple seconds and let them breathe. Realize that everything's okay.
Can I scratch your belly?
Now, when this goes on, we want to make sure that our bandage stays integrous, that it doesn't slide down. If it was sliding down or sliding off the foot or something, then that would tell us we need to go back to square one and start over. Luckily, this one has maintained its positioning. So we're going to keep going. Like I said, we're going to put a little bit more oomph on this as we go. Wrap it a little tighter. Now I'm going to pause right here. We're going to go ahead and place our splint. Alright, now that we've got our cast padding started, we're gonna go ahead and put on our cling. Once again, starting at the toes. On our cling layer, we follow the same rules as before with going up by 50% of the width of the bandage. But with our cling layer, we can go a little more snugly. This is the part where we like to tighten things up. Now after we put our layer of cling all the way up, I am going to work my way back down again. Then we're going to go ahead and place our stirrups once we work our way back down. Alright, we're going to go ahead and pull the stirrups off of our tongue depressor here. So I'm going to just do it one layer at a time. Hey Bubba. Alright, we're going to just gently turn it back and adhere it to the back of the leg. Making sure that there are no wrinkles that could potentially affect the limb. And same thing on the front. Hey, Bubba. Alright, we're going to go ahead and apply our stirrups now. I have removed our tongue depressor, and what we're doing is we're just folding them around like so, and then sticking them to the bandage itself. Now when we do this, we want to make sure that it's wrinkle free while it's attached to the limb so that it doesn't affect our bandage in any way. It can be the fun part about working with tape, making sure that everything stays straight and sticks appropriately. Now we're going to go ahead and use a splint. I've got one right here. I'm going to just place the limb into it. I'm going to have my next pack of cling. And then we're just going to start at the bottom and work our way up, the same way we have with all of our other bandaging steps. You can sometimes have an assistant make sure that that stays attached to the leg. Thank you, Mildred. And we're just working our way up. He says, as long as I have peanut butter, I'm okay with this.
You guys want him out?
All the way up, and then we'll work our way back down. And then we're going to go ahead and start with our vet wrap now. Once again, starting at the toes, keeping those two toes out of bandage. I know, Bubba, it sure is strange, huh? Same principle again, 50% of the width of your bandaging material as you go, ensuring that there are no wrinkles. And putting just so that everything stays snug. There are a wide variety of splints that can be used. A lot of times it just depends on what the reasoning for splinting was. In this case, of course, we used what was on hand at the clinic since it wasn't medically indicated for NASH to have a splint. Alrighty, so the final step is applying a layer of elasticon. We do this around the top of the bandage just to help prevent it from sliding down, anything becoming, and we've got actually a piece of foam that folds down there, so I want to make sure that that's folded down so that when we elasticon the top, everything is protected. As you can see, our lower levels of the bandage comes up past the top of the splint. So we just want to add that additional layer of protection. You want to make sure that your bandage completely covers where your splint is going so you don't have any type of rubs or anything like that. You want to put the elasticon about 50% on the patient and 50% on the bandage, which is super easy since it has that handy dandy little red line. And that would be how to apply a modified Robert Jones bandage with a splint. All right, Nashi, we're gonna go ahead and now remove it. The way we would go about that is by, of course, using our handy dandy bandage scissors. We're gonna remove it layer by layer, so I'm gonna start by cutting off slowly that wrap. This is when a splint is especially handy. All right, we're gonna go ahead and shoot some dental x-rays. We've got our patient here. He is intubated. We've got monitoring going and IV fluids. We have a handheld dental x-ray. So what we do is we insert the plate in between the teeth back here. And then we're gonna shoot from a bisecting angle back here. Since we do have a handheld machine, we have a little bit more freedom about getting our angles exactly right, a little bit more movement, a little easier. Alright. Okay. Alright, we're going to do a hand scaling on our patient here, Titan's teeth. Just for demonstration purposes, I'll just show you one. I've got my scaler here. I am going to use it to remove any tartar that's on the surface of the tooth. Generally, we would start at the back and work our way forward, but so that you can see it more clearly, I'll come up here. And I'm going to work on this one right here. You can see there's a small amount of tartar on there. I want to go at an angle and just manually scrape that off. You can see it's breaking it up. You want to be slow and steady with this process so you don't damage the enamel of the tooth. You may have to adjust your position so that you can get all facets of the tooth. Like I said, you don't want to scrape too hard. After you do this, we'll go back, we'll polish the tooth, rinse it out. We may have to do more scaling by hand, but you'll just repeat the process, number one, so that you're not putting too much stress on the tooth, but still getting it clean. And number two, that you aren't damaging the tooth. You want to make sure that you're firm but gentle, so that you're not gouging in and causing permanent marks on that tooth that will not come out with polishing. Okay. All right, we're gonna do ultrasonic scaling on Rusty's teeth. He's here for a dental. As you see, I've got my ultrasonic scaler. We've got our scaling tip on there. Now, important things to remember are you never want to touch the tip of the scaler to the tooth. Sorry, my glasses are getting a little foggy. You never want to touch the tip of the scaler to the tooth. And you always want to go at an angle, kind of like a 45, and use the side of the scaler. You need to make sure that your water pressure is turned up. And you always want to make sure that you have it set at the correct power. Going too strong can damage the tooth. A good rule of thumb to always remember as well is whenever you're scaling, you never want to stay on the same tooth for more than 15 seconds. It can be very damaging. You can actually kill teeth that way. So I want to just pick a part of the tooth and start. I like to start on, say, a back corner and then work my way across the top and then work my way down. You might have to adjust the way you hold the scaler so you can be touching the appropriate part of the tooth with the appropriate part of the scaler. It's pedal operated, so we're just gonna give it some gas and get started. Once you've been on tooth for what you feel is an appropriate amount of time, you can move on to another one and then come back to it later. And that is how you ultrasonically scale teeth. Okay, now that we're done scaling Rusty's teeth, we're gonna go ahead and polish them up. We use a Prophy paste, and I've got a polisher here. It has a detachable head, so you can change it out for every patient. And then we make sure to sterilize everything super well after every dental, because you've got some pretty gross gunk in here. And what you wanna do is make sure you have a good amount of Prophy paste. I'll actually do a little bit more. To fill the cup, and you want to pick a tooth. You should always start on the very back teeth and work your way forward. This is true with any type of dental procedure that you're doing. For the purpose of this video, I'll do what I've been doing previously and demonstrate on a front tooth up here. What you want to do is make sure you're covering the whole tooth, polishing every part of it, getting around on the sides, around the top, around the back. Basically what you're doing when you're polishing any type of marks, scars on the teeth that you may put in from your scaling, whether ultrasonically or by hand, the Prophy paste goes back over, helps basically polish away all those imperfections so that we don't have those imperfections for gross things to build up in, like bacteria. Alright, we're going to do a dental discharge role play with Mildred here, my lovely assistant. So we'll just go over the steps for that. So what we have here, Fluffy had a dental today. She did great through the procedure. She was under for only about an hour. Her dental was extremely straightforward. We took some radiographs while she was anesthetized, and all of that looked fantastic. I've got a sheet here with some instructions, but before I go over this, do you have any questions for me?
When is she able to eat?
She can eat a little bit later on tonight. Her procedure was this morning, so it's been several hours since she's been recovering from anesthesia. So tonight before bed, she can have a small meal. She will most likely be more comfortable with soft food for tonight, just because her mouth might feel a little bit funny. And that's actually on my sheet here. So we've got here that she can have a small amount of soft food tonight when she goes home. And starting tomorrow, since we had no extractions, she can go back to her regular meal schedule. If she doesn't eat, if she doesn't seem interested, tonight that can be normal. However, if she goes more than 12 hours without eating, then please give us a call. So in the morning, if she's still not eating and not interested in food, then definitely give us a call so we can take a peek at her and make sure that everything is okay. So like I said, we had no extractions. So the only medication that she's currently still on is her antibiotic, which was given by injection a week ago. That's still good for another week. We're also sending you guys home with a water additive. It's a Veterinary water additive to help keep those teeth squeaky clean and healthy now that we've got everything cleaned off of them. If you notice her vomiting, diarrhea, lethargic, anything like that, then we definitely want to know sooner rather than later so that we can address any problems if they do arise. We don't expect any problems. Everything went super great today.
Okay.
We do have a recheck appointment scheduled for you guys in 5 days at 9:30. We'll want to see her then, just make sure she's doing well after her procedure. But if you have any questions in between now and then definitely give us a call.
Okay.
Do you have any other questions for me?
No, we're good.
All right, so what we'll do then is we will sign this form at checkout
Okay.
and we will get you guys all home.